This is what we're going to be talking about probably for the next 4 or 5 hours, neurobiology of affect regulation. We're going to go into a lot more detail than we did in the Introduction to Psychopharmacology class. And I think it's a lot of clinically relevant material here. We're going to look in detail again also at the neurobiology of mood disorders and anxiety disorders. And then we're going to be taking a look at a number of very practical and applied approaches using non-medical approaches that can complement psychotherapy and medication treatment. Now, I think it's humbling for us to have to acknowledge the limitations of current psychological and psychiatric treatment. Even in the hands of experts, there are many people that are hard to treat. The goal is always to, of course, reduce suffering and, if possible, get remission. But it's oftentimes hard to achieve if you just use psychotherapy or just use psychiatric medications. I'm going to take just a minute here and very briefly review some of the outcome data that really supports what I'm saying. Psychotherapy outcomes, and most of the psychotherapy research has been with major depression, and this just shows at a glance the remission rates for people that have major unipolar depression in these 4 types of empirically validated psychotherapies, and not bad, but also not stellar. But these are remission rates. How about medication treatments? Again, just a snapshot of this. This is from the STAR-D program, National Institute of Mental Health, where they did aggressive treatment with very, very ill patients. People had severe major depression complicated by lots of comorbidity, and they did it the right way. They used aggressive treatment. And as we covered before, there were different phases of the STAR-D program, and these are the remission rates associated with the first medication. Then step 2, phase 2, is where they either added a drug, augmented, or they switched to their class medications. And finally, stage 3 would again include switches or augmentation. And at first glance, 67%, well, certainly not, hitting a home run by any stretch of the imagination. But with these incredibly sick people, maybe it's not too bad. And this figure is just medication alone without psychotherapy. However, people stayed in treatment for a year. Upon follow-up, we only had 43% that continue to be in a state of remission. So what you're looking for is not only remission, but also stable remission, where people are not going to have relapses. And again, I think it's the truth. It's the limitations probably of currently available treatments. Of course, the big problem with this is that there are no home run pills. Okay, that there's a lot of medication treatment nowadays being the only treatment for a lot of people with psychiatric disorders in the United States. And I don't have to tell psychotherapists the way to go is integrated treatment models.